I want to talk about something that honestly stopped me in my tracks during a recent Senate hearing. Not confusion, not even your usual political disagreement. What I heard was gaslighting, at a level that's honestly hard to wrap your head around. Senator Maggie Hassan wasn't having it. And what followed was one of the clearest, hardest-hitting takedowns of abortion misinformation I've seen in a long time.
You know, I have to say, Mr. Chair, this hearing has just struck me as gaslighting at the highest level. I have some questions for Dr. Verma. I'm going to get to them in just a second, but let me be clear. There is bipartisan work that we have all done together to combat sex trafficking. Those signs you saw in Southwest Airlines plane, that's because we passed a law that said they have to go up in airports and on planes. That was bipartisan work we all did. The truth of the matter is that women have been coerced before mifepristone, and they've been coerced since mifepristone. The murder rate, the assault rate on pregnant women by their partners to end a pregnancy has been a long-standing part of human history. So to blame it on mifepristone misses the point. To say that women shouldn't be able to get this medication through the mail misses the point that abortion bans have created maternal health and reproductive health deserts in this country, so that when you say a woman should go consult with a physician, there are women who would have to travel hours in this country, miss work, find a babysitter, if they have a car to begin with, in order to do that because of policies that have banned abortion and have cut Medicaid in particular. That's what we are facing. There is bipartisan concern that women be able to access health care. There is a bipartisan understanding that reproductive care, to Dr. Vermer's point, is complex. When I had a miscarriage at 12 weeks, it was painful. And it was hard, and it was emotional, and mifepristone had nothing to do with it. And I didn't use mifepristone. I had to have a D&C. So the gaslighting here is extraordinary.
Here's what actually went down. Senator Hassan went straight at Republican claims that abortion medication, specifically mifepristone, somehow causes coercion or abuse. She didn't just say, "I disagree." She called it out for what it is, a distraction. Violence against pregnant women didn't start with abortion pills. It's been happening for generations. Pretending that medication is to blame, that's not just wrong, it's a way to avoid talking about the real, everyday dangers women face. But what really got me was when Senator Hassan brought up something called maternal care deserts. Because of bans, clinic closures, and Medicaid cuts, there are entire regions where women have to drive for hours just to see a doctor. Some of these women miss work. They scramble for child care. They spend money they don't have, all just to get basic care. This isn't a hypothetical debate. This is the reality for millions of women right now in America. And then, she got personal. She talked about her own miscarriage. She made it clear mifepristone had nothing to do with it. Miscarriage care often means medical intervention. It's complicated, it's emotional, and it's medical, not some political talking point. For years, this was common ground. People on both sides understood. But now, even that's being twisted. Senator Hassan didn't stop there. She defended Planned Parenthood, not as a political football, but as a lifeline. She told the story of a veteran who depended on Planned Parenthood for care after leaving the military, cancer screenings, STI treatment, regular checkups. When funding was stripped, those services disappeared.
So let's talk about the real issues. Dr. Verma, Planned Parenthood provides life-saving health care for millions of women. So I recently heard from a constituent, Tricia, in Center Ossipee, New Hampshire, who went to Planned Parenthood to get affordable, basic health care after she left the military. Tricia shared that without Planned Parenthood's sliding fee scale based on income, she wouldn't have been able to see an OBGYN at all. During one of her appointments at Planned Parenthood, Tricia was tested and treated for a reproductive health condition that, if left untreated, could have led her to have serious health complications down the road. Now, President Trump and congressional Republicans stripped Planned Parenthood of critical funding last year, taking life-saving preventive care and screenings away from women like Tricia. Dr. Verma, what long-term health impacts could women like Tricia face as a result of President Trump defunding Planned Parenthood?
Thank you for that question and for sharing your story. I see patients like this all the time where Planned Parenthood plays a critical role in their healthcare access for things like cancer screenings, sexually transmitted infection screenings, birth control, in addition to abortion care and miscarriage management. And not having that access point will have devastating effects on people's ability to detect signs of cervical cancer or precancer early, to have sexually transmitted infections treated, to have a lot of the preventive care that people need to stay healthy.
Thank you. I've heard from Granite Staters who took mifepristone after the loss of a much-wanted pregnancy. So, Dr. Verma, I understand that there are serious health risks for women if they have a miscarriage that goes untreated. When a state restricts access to mifepristone, what are the health impacts for women experiencing miscarriage?
Absolutely. Thank you for that question. We know based on the data that mifepristone combined with misoprostol for women that want medication management of their miscarriage is the ideal option. And already because of restrictions on mifepristone, many women can't get that standard of care treatment that speeds up the process, reduces pain, and decreases their need to have a procedure if that's something that they don't want.
Thank you. Last question. Millions of women live in maternal care deserts where the nearest OBGYN is sometimes hours away, as I referenced in my initial comments. Women who don't have access to a specialist can access safe abortion by getting mifepristone and follow-up care through telehealth. Dr. Verma, how has telehealth changed access to safe reproductive care in rural areas?
Thank you. It has made it more accessible. And again, like I emphasized earlier, there is a process for telehealth. There are regulations, there are strict screenings that happen. And what is really the issue here is when people need additional care, they can't get it in their communities without fear of being criminalized.
Thank you very much.
Dr. Verma warned, without these clinics, more cancers go undetected, more infections go untreated, and preventable health crises explode. And in rural America, telehealth has been a game changer. Medication abortion, miscarriage care delivered safely, remotely. For so many women, it's the only option. But now, even that lifeline is under threat. Laws and fear of criminalization are stopping women from getting follow-up care when they need it most. When I zoom out and look at the whole hearing, it's obvious. This wasn't about protecting women. It was about rewriting reality. Senator Hassan and Dr. Verma cut through the noise and put actual lives back at the center. This is what honest accountability looks like. And honestly, it's why these moments can't be ignored. If this matters to you, hit subscribe. Don't let these stories get buried.